being a
Sure.
part of this and being flexible about our
Sure.
technology.
And we're expecting Dr. Collins, who will be with us, I don't think, hopefully in a minute or so. So I'd like to wait for him if we can. I know.
Sure.
I forwarded him the new invite. I had just barely begun kind of going through this with Robin and Deb, Patrick. So I'll just kind of continue on my first question.
Great.
And
Okay.
hopefully Brian will join us and be able to maybe clarify his perspective or what he sees going on. So I basically started by saying that it seems like from our community providers that there's a little bit of confusion when patients are seen, have a dental home, and then are seen by the 802 Smiles program, and that there seems to be some wires crossed between treatment plans and what community providers wanted to do, and then a patient may show up with something different done. So I think our ask for you to maybe explain or see if there's something we can do about possibly if patients have a dental home, if they're seeing a dentist, if they have been in recently, either communicating with the dentist to say, hey, we saw Johnny in the chair today. We're going to recommend.
Here he is.
I'm back.
Hi, Brian.
I found the link.
Yeah, sorry about the confusion. We're not sure what
That's all
happened
right.
there, but glad you made it.
Brian, so I just basically started introducing my first question here about the kind of the confusion of patients that are seeing 802 Smiles, seen in a community office, and I was kind of asking maybe Robin and Deb to kind of see if there's a way that we could either, if we see a patient at 802 Smiles, if we can communicate with the dentist to see if the dentist has a plan and is going to see them in their office soon, or to say, you already have a dentist, so you should see your regular provider in their office. So I'll let you guys take it from there and see what we can do.
Thanks, Justin. And I'll let Deb take the lead on responding to these questions because Deborah is the coordinator of the 802 Smiles program. But just wanted to begin by saying, thank you for giving us the opportunity to respond to these questions. I know that Office of Oral Health and Vermont State Dental Society might come at things from different perspectives, but we all have the same goal in mind, and that is better oral health for Vermont kids. So if I hear what you're saying correctly, kind of how do we handle that when a student checks that box saying, I do have a dentist, I would like services at 802 Smiles. How is that information, once services are provided, conveyed to dental practices? And I guess before I turn things over to Deborah, I would say that we don't limit 802 Smiles to families who say they don't have a dentist with the tooth tutor program. And some of you might remember that from years back. That was what that was all about. We'd develop a target group of children who haven't been to the dentist in the previous year according to their records. And then we'd work throughout the year to connect them with a local dental home. And unfortunately, although that did help some kids, it just wasn't effective when we looked at our statewide oral health indicators. So what we keep an eye on here at the health department is sealant rates, percentage of kids who have sealants, percentage of Vermont kids who have treated and untreated decay. And so the recommendation after formal evaluation of that program was really to move towards providing services in schools. And the reason that we don't limit it to children who don't have any dentist listed on their form, on their health history form, is because there can be a lot of times where a dentist is listed, but that's maybe the child had been there once, a few years ago. So the goal with 802 Smiles is to ensure all kids have good oral health, and 802 Smiles does prioritize children that do not have a dentist listed. So we start there, and there is a mechanism to communicate with dental practices when there is one on file to say, these were the services that were provided today. But I'll turn things over to Deborah, and you can pick things up from there.
Sure, I think Robin gave a very good and comprehensive overview of how why things have changed since the Tooth Tutor program. So like Robin said, with the Tooth Tutor program, many kids were falling through the cracks. We saw that very often, like there was a name on file, maybe that's where they went for their surgical care when they were 2 years old and they never went back, or maybe they didn't come back, they went for an emergency visit and they never went back for the prevention aspect, or they don't. So the truth is, in those cases, they don't have a dental home where they can receive ongoing and comprehensive oral health care. Since 802 Smiles wants to, well, we work to ensure that all kids have the best possible oral health. We do prioritize, that's part of our very clear guidance, prioritize children who don't have a dentist listed on file. That is absolutely the priority. If they don't have any dentist listed, prioritize those children. And of course, after providing the preventive services that they are that they haven't received yet, refer them, work with the families to refer them to a dental home. Our goal is to refer every kid to a dental home. We know that that's the ideal world where every child has a dental home. Unfortunately, we know that's not the case. So what happens then? Suppose that, I mean, we do take care not to overlap or duplicate services like we're talking here, but what happens when a hygienist sees a child that does have a dental home? For any reason, the guardian still chose for that child to be seen at the school and receive preventive services for some reason. Maybe they missed their prevention visit at the dental home. So there's a multitude of things that may have happened. After treatment is rendered, the hygienist uses the report on dental findings form that was developed by the Board of Dental Examiners with our input. And they are, the guidance says that they should ideally on the same day that they provide those services, they should fax over that report on dental findings to the dental practice and gently tell the family, hey, the guardian also receives a copy of that form. And the hygienist would say gently, hey, we provided the preventive services that were overdue. And now we recommend that you go back to your original dentist for follow-up and comprehensive care. And also we explain that a child can't rely solely on school-based services for many reasons. We explain this to families. For example, they may have an emergency over a weekend and the hygienist can't, it's a limited scope of work. Plus they're not going to be there over the weekend. A child may fall during school vacations and break a tooth, they need to have that dental home for that situation. Or when they leave school, we want them to get into the habit of going to the dentist regularly. So we by any means imply or intend to replace dental care provided at a dental home. We just don't want to see kids falling through the cracks like they were, and this is evidenced by our data. It shows that the situation has gotten, unfortunately, worse in the past 10 years. So I hope this helped a little bit to explain how, the process of communicating with families, the process of communicating with dental homes.
If I can just add to what
Please,
Deborah said,
yeah.
and I did put the form that Deborah was referring to in the chat. As you can see, this does, at the end of this form, talk about the fact that we recommend, or ideally, all children will have a dental home. This does not take the place of a dental home. But we did have a situation arise recently, and as our program moves to, as the program 802 Smiles moves to provide more services in schools versus the older version, which was to connect kids to dental practices. You know, we expect that this will happen once in a while, but we want to minimize the times that this happens. So a child was going to have sealants at a dental practice. They had sealants through 802 Smiles. The form was not sent to the dental practice in that situation. So what we have done, what Deborah has done is organized another case management refresher training for all the 802 Smiles hygienists. This will be a time to really emphasize, hey, when you start an 802 Smiles program, or annually, every year, every new school year, here's a template letter that you can use to send to all the local dentists in the area, inviting them to be a referral source for you, letting them know that you're here. You'll be hearing from them if they see people that have identified you as their dentist. Let's work in partnership. And also reminding all of the 802 Smiles hygienists about the importance of using this report of dental findings form, which, as Deborah said, if there's a dentist on file, we'll go to that dentist as well as the parent or guardian. Yeah.
I think so. Thank you for kind of going over that, and I'll let Dr. Collins, if he wants to chime in here. But I think from what I'm understanding from the community, I know they do that. They fill out the forms, and the parents, you know, sign the dental forms that come home. But I think the confusion is they don't really know what they're signing, and they don't really know what that means. And again, Brian, you can tag on here, and I think maybe, and I don't know if this is possible, is there a way to contact the dentist prior to seeing the kid in the school? If they tag a dental home there, you know, maybe calling calling UVM Dental and saying, hey, is Johnny Smith a patient there? Have they actually been seen there? And we would say, yeah, they were here in 2018, but you know, they haven't been back since. Or yeah, he's on the schedule for next week, or something like that, to make it a smoother transition. I don't know. Let me know what you think.
If I may, Deborah, sorry.
No, that's okay. No, go ahead.
I think there are things that we can do to clarify the permission form. We're in the process right now of making it, of developing a video that step-by-step walks parents through. The permission form is complicated. Unfortunately, it has to be a little more complicated than we like it, because we have to work with our legal team to make sure all of the I's are dotted and the T's are crossed.
I know how that works for sure.
Yeah.
I live in that world.
Right. So for a hygienist, when they're in a school providing these services, this might be the only time that they have the opportunity to see these kids. The kids that we're talking about, like we said, can fall through the cracks. So I feel like it would be a barrier, because having to stop and call the dental office might be adding some time. We might be able to not get to them right away. The time that the hygienist has to spend with the child in the school setting is very limited. So I think that there are things that we can do to make the permission form as simple and as clear as possible. One thing I forgot to mention is, as a result of this incident with the sealant that we had recently, we also redid our introduction letter that comes from the school to the families, from the principal of the school, to say, we're offering these services in school. Ideally, you know, if you have a dentist where you receive comprehensive oral health care regularly, stick with them, you know. So we've tried to make that really clear in the opening letter. We can make that more clear in the permission form. And then, like I said, we're developing this video, a step-by-step process of how to fill out this form. Deborah?
Yes, I think that's it. I mean, of course, it's in every transition, there's a little bit of we're going to be learning from mistakes, and people are humans. Like, this hygienist didn't intend to cause any harm or any problem, but this person did forget to send the report on dental findings. And I believe that's what caused an issue. So we're learning from that mistake and that shortcoming, and we're improving. It's continuous improving, and I think we're prepared to do that. We have the support we need to do that. And like Robin said, we're revising our forms constantly to make sure that they are as user-friendly as possible. Just yesterday, we had a meeting with someone who has experience in making videos. We're going to make a short video to send to families on how to fill that form step by step and what each line means. And we're adding clear information, as clear as possible, both to communications that go from the school to parents at the beginning of the school year, and to the consent form about what Robin just said. If your child has a dental home or a regular dentist where they receive ongoing care, we recommend that you stay with your dental home. So I am very confident that these changes will help address any problems, and hopefully they won't happen again.
I'm sorry, I'm naive. What was the issue that happened that you're referring to? I missed that piece.
A
Well,
child, yeah.
Yeah.
You go. You
okay.
go. You go.
No, what came to our attention was that a child had a consent form from the family to receive services at the school. And the child had molars that were not sealed, and that should have been sealed. So the hygienist, having the consent from the guardian, placed the sealants as appropriate. And then it turns out that that child had an appointment, I think, in a few months at this particular dental office, and they were rightly so upset that the child had received sealants at the school. So that generated a lot of confusion, and the parent felt bad for that having happened as well. And so we tried to listen to all the different sides so we could put that puzzle together and see where was the breakdown in communication here. And based on all that, we improved these things that we've mentioned. So we're working, the training on care coordination is being developed right now. The hygienist will be taking that refresher training on care coordination prior to the upcoming school year. And our forms are being revised, our communications protocols are being reinforced. It's a learning process. We're continuously striving to improve.
Now there's, yeah.
I don't want to, I think we all are in humongous favor of this program happening. I'm a public health guy. I had a school-based program under me in my previous life. It was probably the only chance that a ton of the kids got to see dentists. So I don't want you to think that this is not a in support of conversation, because we totally are. I think I'm trying to make it seamless for these patients who have a dental home. And I don't know, maybe Brian, do you want to weigh in here about what you see?
So I was a sponsor for 3 different hygienists during the tooth tutor program for years. And so, like Justin, I'm in favor of dental health education for parents and kids through the schools. The issues that's coming up since the changes of providing care are parents. I see the stuff that, the documents that go out, and I get the forms of all the patients that are seen. But parents think that they're okaying health education and maybe an extra cleaning. In their words, the parents that talk to us say, "Oh, I thought it was for an extra cleaning between cleanings, and I thought an extra cleaning would be good." And sure, that's fine. We don't have a problem with that. But they're nobody's checking really to see if these kids have appointments set up or if they have stuff scheduled. We've had kids show up having had a cleaning at school and having had an appointment booked 6 months out for their recall visit with us, and they show up the next day for their recall, and they're like, "Oh, you're going to clean their teeth? They just got cleaned yesterday at school." And they're not clear on, it's like nobody asked the parent if the kid had a recall set up the next day. The other problem with sealants being put on, if a tooth needs to be sealed, that's fine. We don't have a problem with that. Monday this week, we had a kid come in who'd been seen in February for an initial exam and treatment planning. Kid had a bunch of proximal caries on primary molars and one permanent molar with an occlusal lesion. Was scheduled for treatment. Showed up. The mom had brought the kid for the new patient exam. Showed up with the dad. And had a bunch of sealants on these primary molars that had proximal caries that were planned to be restored, and had a sealant on the carious permanent molar, but not over the carious lesion. That lesion was still exposed, so that sealant wasn't really doing a whole lot. And the dad had no idea that the kid had had anything done at school at all. And they used a sealant that you could easily see. So we were able to show the kid, well, this is actually Andy that had this patient, was able to show the dad, yeah, this stuff was done, not by us. And the dad had no idea what had been done. And the mom hadn't told the dad that they'd signed off on the kid being seen in the 802 Smiles program. And then all this stuff that the kid had done was going to get taken out because these teeth were going to be restored. So, the kids had an extra procedure for nothing. And all it would take is proper consent or checking with our office. I mean, we had, in 2023, we had over 43 patients who have a dental home in our office. Those aren't like one-off patients. That's patients who were seen multiple times in our office. So, we're covering a lot of kids, and, it's not that hard to check and see if we're seeing somebody on a regular basis. We do have one-off kids that we've seen for like a hospital case. We last saw them in 2018, and that's it. And we have records on them too. But, like I said, we got over 4,300 kids that we're actively seeing. So we're seeing an awful lot of kids, and we can get kids in if they have an urgent need in a day. If they have an emergent need, we can get them in the same day. And we do that week in and week out. So the parents have no clue what they're agreeing to. And we've heard this over and over and over and over. The second case this week also involved a sealant. Patient who parent works for a physician in town, and had a sealant done and was complaining to the parent afterwards that it felt weird, and asking the mom to not be seen anywhere but our office, and which I thought was an amusing anecdote, but that just sort of illustrates that the parent had no idea the kid was getting something applied to their teeth. They thought they were getting an extra cleaning, in their words. So parents don't know what they're agreeing to. So I think there needs to be an awful lot better explanation process. And if there's carious teeth, check with somebody that might be treating the kid before you do anything, because we don't like to put kids through more treatment than they have to go through, and we especially don't have to come back and redo stuff that's the kid had done. So I think a lot more coordination, or if anybody is identified before anything else is done, check with that office and see if they've got stuff scheduled. We get all these reports, and sometimes they say like, well, many cavities, or blah blah blah, or this needs this. Well, yeah, because we just saw the kid 3 weeks ago for an exam and they're set up for treatment. We already know this. This is not beneficial to spend time looking at this stuff. So it's nice to get these to and if we were getting these on kids that didn't have a home and needed to be seen, we're happy to take the referrals and see the kids. But all the reports we're getting are kids who are in the practice. And anyway, that's sort of, it's an extra step for us to do this stuff, and it's extra stuff that the kids are having done that they may or may not really be benefiting from. And the whole silver diamond fluoride thing is another issue. We can address that separately, but
Yeah, I think so. So go ahead, Robin. I'll let you.
Yeah, I hear what you're saying. It's hard to comment on the clinical stuff, obviously, because we haven't seen it. There is, training that the hygienists go through 802 Smiles, and all the hygienists working, as you know, I'm sure, as 802 Smiles hygienists do have a supervising dentist. I mean, the situation that you describe sounds concerning. I think that would be one where we'd want to, if you could get permission from the parent, we can follow up with them. We can talk to the hygienist. Like, obviously, that's not something that we would want to let go. We obviously hope all children are getting high quality care, that the care that they're getting in school is high quality. Just to clarify too, you've seen 43 patients that are regular patients of your practice were seen in the schools.
no,
Is
I'm
that-
saying we have over 4,300 patients that have a dental home in our office as of 2023. I mean, these are kids just in 2023 with multiple visits and multiple recalls. So
Right.
we're seeing a ton of kids.
Yeah.
So, the odds of, so like this is the stack of kids that 802 Smiles has seen, and they're all patients of record over the office. So with us seeing that many kids, the odds are high that anybody in the surrounding counties, could be seen here. And so a quick check with us, will let people know whether or not we've got recalls scheduled or if we've got treatment scheduled, or stuff diagnosed and the parent, in fact, maybe didn't follow up and needs to come back. Sometimes you have people that you explain stuff to them, here's the problem, and then they don't want to book anything. And, you can't make them schedule to bring the kid in for treatment. But we're aware of the decay. We have a treatment plan recommended. We talk to the parent. And sure, if a hygienist sees that kid and says, yeah, there's a lot of decay here, we would appreciate, sure, tell the parent, yeah, you need to follow up with somebody.
Yeah.
But it's, I would really, before treatment's provided, I think that they ought to really check and make sure that that's not planned somewhere else or that hasn't already been recommended or maybe isn't already scheduled.
Again, I think that when a hygienist sees a child in a school, it's very time limited, but there are things that we can do to make it clear that if you have a dental home that you're able to get to on a regular basis, then please continue to get your care there. So we can do that, and we can follow up with you regarding this situation. We can follow up with the supervising dentist, and we were talking about this before the meeting. If any situations arise like that, if this could not be a one-time conversation, if we could continue to talk about 802 Smiles, obviously, because this is a partnership, if you could get permission, and then we could work through those situations together to improve them or to address them.
I think that's great. I think again, I'll be happy to facilitate connecting you guys and leave that line open. I do agree that maybe if there's some way that we can, like the parents turn their paperwork in first, right? And you guys focus on the ones that don't have a dental home. It seems to me like there's a little time frame in there where if there were kids whose parents returned the paperwork, we could reach out to Middlebury Peds or Timberlane or Dr. Ray's or something and say, is Johnny Smith a patient? And I think that that seemingly would get rid of that hurdle. And I believe me, I understand the patients in school, they're in the chair, and maybe the only time they're in school that day. I get all that. And I feel that, we do the same thing with adults every day. So I think there's a chance there to make it smoother. And I guess that was kind of our hope.
Yeah, can I just add something? I feel like amping up this message that if you have a dental home, we recommend that you stay with it. Just amplifying this messaging has huge potential to change these things and prevent situations like the ones we're discussing. Not that we didn't have this messaging before, but we're just blasting it louder now. We realize the need to make it loud and clear. So I'm very confident that this will help a lot moving forward.
So I was dental school faculty part-time for 16 years. So I've been out to elementary schools and supervised dental students putting sealants on kids. And I've worked in dental vans on a volunteer basis and done treatment on kids from disadvantaged communities and immigrant communities. And so, yeah, I kind of know how this process works. And yeah, we've had kids get scheduled in and, and have sealants done in the school program, and you look and it's like, because I would always examine the kid before anybody else touched the kid. And yeah, some of the kids had great teeth and they had sealants in place already. It's like, you know what, you're good to go. But so I understand the limits of trying to do stuff in schools because I've done it. But yeah, I think broadcasting to the parents in big bold letters, so they know what they're agreeing to, because the tooth tutor program is a historically beloved program that people still have awareness of, even though it's been gone for a while. And so they're like, oh yeah, sign up for that. I had that when a lot of parents would say, yeah, the tooth tutor would come when I was in school. And, it's a very warmly thought of program. And so they are happy to sign up for 802 Smiles. But they just don't know what they're agreeing to. And so broadcasting what they're consenting to is important, I think, and reinforcing that. Oh yeah, and by the way, if you have a dentist, let us know so we can contact him.
Maura?
I think,
Oh, sorry.
so I know Maura has a hand up. Again, even if communication is the key, if we can connect, Dr. Collins' practice with the team that works in his area and say, every time we get a batch of forms, if somebody says Middlebury Peds, we can shoot a quick email and say, hey, Johnny Smith, Timmy, Susie signed up. Are they patients there? I mean, something like that is quick and easy. And again, could limit these awkward situations where patients are showing up at, Dr. Collins' office and, they're kind of in between. Sorry, Maura, for jumping in front of you.
No, it's fine. I'm just trying to get a sense of the scope and scale of the concerns here. It sounds, I know from having worked next door to Dr. Collins' office, we were like, it was amazing when you built your practice next to the WIC office and we had a easy, ready referral, like go across the street. So I'm just wondering, is this more of a concern among the pediatric sort of specialty that you, Timberlane, because you are seeing more kids and you do see that you are able to see them more regularly, and maybe in other parts of the state where there's less access and there are more kids who just don't get in, like this is a real stopgap program. I'm just trying to get a sense of that.
So for us, less than, I'm trying to remember, Andy, he's the MPH in the practice. So he knows all this data off the top of his head. My memory is moth-eaten, but our patient base is less than 50% Addison County.
Yeah.
We get a ton of people from Rutland County. We literally, Justin and Patrick have heard this before, but we get patients from every county in the state. Yeah, we're here in Middlebury, but that was just because that's where I was going to retire. And yeah, Addison County, under half of our patients are Addison County patients. And so
yeah, I would just add, every pediatric dentist in Vermont that we've talked to says, they're coming from at least some from 2 hours away. So
yeah,
I think we're lacking more pediatric providers for one thing, but they are traveling hours to get to a dental appointment.
So I imagine that your follow-up may, this is an assumption, so correct me, like, you probably, because once families are in, I'm hoping that they say, oh my God, we gotta get our kids back there. You may see kids more regularly than other providers are, is because you're a pediatric focused dentist. I don't know, or there's more, or people who are getting in are making the effort to get to you in a way that's a little more comprehensive. I just wonder, like in Northeast Kingdom and, the southern part of the state, if there are more kids who are really just benefiting from 802 Smiles because they really don't have good access. I don't know.
For sure.
Okay.
They're for sure. I mean, these, the Collinses, Timberlane, Just for Kids, they see patients from all over the place, but there are for sure areas that, like I said, it's why, I think these programs are invaluable, because there are some kids who won't, see a pediatric dentist no matter what. But yes, a lot of the cases and the things that we're talking about have come from the peds community. And that's kind of where we the interest for this meeting and the kind of the stories we compiled were from.
Thank you. Okay, thanks. I just needed to understand. Thanks, appreciate it.
If I-
Sorry, excuse me one sec.
I'm sorry. Adjusted the pressure.
Robin, you can go ahead. We'll
Yeah,
find them.
so I was just going to bring up that I think this is actually a place where the 802 Smiles programs have great potential to partner with local dental practices. You mentioned people traveling from 2 hours away. Even if a parent who maybe doesn't get time off from work to get to dental appointments, even if that parent does go to Dr. Collins' practice, wouldn't it be great if that child could get those sealants or SDF at the school, and then
1000%.
go, so it becomes more nuanced. We're not going to call parents, oh, you see Dr. Collins, okay, we're not going to treat you. I think that's where pediatric dental practice, any kind of dental practice, and the 802 Smiles program can work in partnership. And even with the situation where we had sealants placed and the dental practice didn't know, if the dental practice knew that the sealants were placed, great, they can cancel that appointment time. That frees up the appointment time for someone else.
Yeah. So, and I think Dr. Collins would agree with that. And I think that's why maybe the communication ahead of time would work. If there were a hygienist that said, hey, Timmy Smith is from Newport, you're in Middlebury, we can do the sealants here. Are you okay with that? And I mean, I know he stepped away, but I'm 1,000% sure that Dr. Collins would probably say, yes, please put sealants on. We haven't, it's 2 hours away for Jimmy's parents to drive. I think, and that, I think that's why that communication would be so valuable, maybe ahead of time instead of after, this, the patient's already done and gone.
Yeah, we
but
can continue.
I totally agree with you. I think that's why the in-school services are so valuable.
Yeah, I mean, that's the thing, and that's the heart of the matter. Issues are coming up, we're working through the issues, but the bottom line is that our data that just came out shows that 42% of the kids in 3rd grade don't have dental sealants, or do. I can't remember.
That's okay.
Anyway, it's low. It's too low. And 1 in 4 need dental care. So whatever it is that we've been doing all along is clearly not working. So we got to do something different. And we're going to have bumps in the road. I don't know what that could look like. We can continue to talk about it and think about it, because the parent has signed up. Yes, I want my child to have these services in the school. Yes, I have a dentist. So then are we calling the dentist to say, is this really okay? To do this, you know what I mean? And that's why also I think it comes back to making it really clear on the form, this is what you're signing up for. And also, I think it's really important for the local hygienist, whoever is sending you all those forms, Dr. Collins, to be in close communication with you, absolutely. And that is something that we can stress as part of our case management discussion.
Yeah,
I'm
and I
gonna
think, so go ahead, Maura, go ahead.
I'm just gonna jump in. I have to take my son to catch a bus to go to New York, so I have to leave.
Okay.
I so
Right.
appreciate this conversation. I think the more coordination we can do across the practices and our programs, the better. You all are hitting the right spots. I'm going to go to the Rutland issue quickly to say, one, again, thank you for all the work you all did on this. And two, Dr. Levine expressed concern about the number of opposed votes. And I want to raise that because I think it's really related to how the bill was worded, but it was a tactic that they used. And so with that note, I
So
just want to
Dr.
say,
Levine was not happy with the yes votes.
oh, right. Yes. Thank you.
Yeah.
See, that's
Not the
exactly
no
what I
votes.
mean.
Yes,
The convoluted wording of the bill was confusing.
It was
intentionally.
exactly the same. The split was exactly the same as it was
I
in
know.
2016.
I know.
interesting.
But anyway,
I actually, when I wrote that letter, I had to go back and look. I'm like, am I writing I want people to vote the right way.
Yeah, right.
Like,
I
I did not
know.
read it. So yeah, I mean, I can't. I mean, I get that's definitely a tactic. That's why they did it. I don't know why they let people do that. I mean, I don't know why. Like, if you really want the public to be informed and educated, then you should write something that's straightforward. But
Absolutely. So just know that if that fight comes up again, we may have to really
No,
think
don't
of.
even say that out loud.
I know. Well, I'm hopeful because in one interview he said if we don't win it
Right.
this time, I might be done. Let's hope that that's the case.
Yeah, I
So
agree.
Anyway, thank you. Appreciate it. Sorry I have to run.
See
Bye,
ya.
Maura.
Good to see you again.
I'm wondering if a more regular meeting of this group and maybe including all the PEDS folks from the state, because again, they're the ones that are going to have this most interaction, and maybe that would be great for all of us and to be able to talk through issues that are coming up to continue working, because again, I think we are all in favor of this program being a success. We just want to streamline so it works best for the parents and for us.
Can I add something just building up on what you just said? So I agree. I mean, everybody will benefit from this partnership. If we can work together, coordinate things, and everybody will benefit. One dream of mine is to have, and that's what we've been trying to do through these communications in the beginning of the school year, that the hygienists will be sending these letters to local practices, is to have a referral base, like a solid, so that solid base of these are the dentists who are champions for 802 Smiles, and they are our referral base. So I would love to have ongoing discussions and discuss different ways we can collaborate, and maybe have invite dentists and supervising dentists to the 802 Smiles annual meetings if they can make the time to attend these. I think there's a lot of opportunity for us to work together because we're just working towards the same goals.
Absolutely. I mean, everybody wants kids seen, everybody wants the best for them, and everybody wants to get as many kids in as possible. So I think you're absolutely right. And I think that because Dr. Collins, because Timberlane, because these practices are going to see the follow up after treatment, they're big stakeholders in this, right? If a child needs follow up after, I don't know whether it's discomfort, whether it's just they need dental work, whether it's something's happening. So I think having them at the table would be very valuable.
Sure. We only have 4 minutes left, and we haven't talked about the SDF concern. So I can
Yeah.
stay. I don't know if you want to extend the meeting, or if that's possible?
I have a few. So Brian,
Okay.
please take it if you have time.
Yeah, I've got time.
Okay.
You want me to go first or?
Yeah. Go right ahead.
So our problem with SDF is that it applied into the wrong circumstance. It can cause abscesses. And we've had 3 kids that got SDF applied in the school program, and within a couple of weeks had a tooth that had a large lesion abscess. And you can apply SDF to a deep cavity without causing an abscess. But if you apply it to a tooth that has caries direct to the pulp, you're actually now applying the SDF to the pulp, and pulps don't respond well to that. And so, so far we've seen 3 kids that had that happen. And, I mean, I started putting on SDF the year it was legal to do it in the US, and we use a lot of it. I'm in favor of it being applied. We used a ton of it during COVID when we couldn't do any other treatment for a while. And we use it under a lot of different circumstances. So I'm a proponent of the use of it, but it's not a panacea, and it's not safe to apply it to every single lesion, especially really big lesions. If you don't have x-rays and know how deep the thing is, or if you don't have a really good ballpark idea of how close to the pulp it is, because you're used to looking at thousands and thousands of primary teeth, it can cause problems. So that's my concern about it being done without somebody, looking at the tooth real closely before it's applied. To us, that's a treatment plan thing. We treatment plan SDF and get consent for it specifically from the parents before we put it on any tooth. And we have the conversation also about the fact that it's going to turn gray or black. The other problem with SDS, if you're going to restore a tooth, and then there's black stuff everywhere, then that changes how you restore the tooth. But the idea that it's applied to really big lesions, that's a problem because it can cause abscesses if you don't know how deep the thing is.
Deborah, I'll let you respond to that. Yeah.
I can take the lead on this, Robin, and please feel free to add. I know there are some studies, seems like there are conflicting studies on applying SDF to the pulp. Of course, we don't recommend that anyone would apply SDF directly to the pulp, even though it is indicated as it could be like an indirect pulp capping. It has shown good results in that, and the arrest rate, as you know, doctor, is really high. So there's multiple things to consider in response to your concerns. I think one of them being, well, there's many things. I'm trying to address them in a logical sequence. One is hygienists are trained to it's part of their, it's been decided by the Board of Dental Examiners back in 2018 after much, 17 or 18, after much deliberation and hearing both sides, the pros and cons. It has been decided that it would become part of what they were allowed to do under a general supervision agreement in public health settings. And that's because the benefits outweigh the risks greatly. Imagine these situations where a child doesn't have access to dental care, and it will be weeks, maybe months before they can be seen. By the time they are able to finally get into the office, if nothing is done, we're harming that kid by doing nothing. The SDF at least will buy the time until they can be seen and receive the follow-up care that's recommended. The other thing is that based on, I don't have clinical experience in the United States, but I did practice clinically in Brazil for about 13 years in school settings as well. We did have SDF then. I regret not using it as broadly as I should have back then, but we didn't have the current research on it as solid as it is now. But based on the national experts that really serve as advisors to our program, these are the leads in like SDF research and clinical science. SDF very rarely can be blamed for causing the abscess. They say SDF came too late to the party. Usually that's the case. The tooth had irreversible pulpitis maybe to begin with. It was on its way to abscessing, and applying SDF simply was too late. It doesn't mean that the SDF caused that. And that's based on, like I said, these national experts that share research with us and guide us. So summarizing, we feel like not using it would do more harm potentially to a child. And the number of kids who can benefit from this to buy time, like I said, before they can see a dentist for follow-up care. And as I'm sure you know, there's many teeth where SDF alone may be all they need. If they have very initial decay, and if you do nothing, you're going to have a huge cavity there in a few months. But if you apply SDF to initial decay, it's going to have at least an 80% chance of stopping that decay if it's applied properly and all that. So that's what guides us, the science, the American Dental Association recommendations, the guidelines for non-restorative care. They all say clinicians should prioritize non-invasive manners like SDF first, like that's the first line. So we follow the science. And of course, there are these unfortunate situations where maybe SDF was applied when it was too late. And absolutely, we don't want people applying it directly to the pulp. But if it's too late, the tooth was going to abscess no matter what in many instances.
Well, the three examples that we're citing are teeth that would have been pulps and crowns anyway. And we're treatment planned for that already. But between being treatment planned and getting the treatment, had SDF applied that we had not applied because it wasn't safe to do it. We would have stuck it on the tooth at the time if it had been safe. We didn't do it because that was a deliberate choice. Somebody else, without checking with us, did, and the tooth abscessed because a deep lesion that's asymptomatic but goes to the pulp. It's like sticking SDF right on the pulp. And that will necrose the pulp in a matter of a couple of weeks. So we took those teeth out. The kids, we got, paged on the weekends. We put them on antibiotics. They got an extra round of antibiotics, and then we took out those teeth. So yeah, it can cause harm, and it can cause, problems for people. So I'm in favor of using a lot of SDF. And if it's small lesions, great. And if it's some lesion that you have real confidence it doesn't go to the pulp, great. That'll slow stuff down. Fluoride varnish has almost the same caries arrestment rates that SDF has. If you stick varnish on, varnish doesn't do anything harmful. And it can really arrest, caries if it's used in high frequency.
Can I just interrupt for just 1 second?
Sure.
Again, this is this situation, the situation that you talked about earlier, really specific situations. Obviously, we don't have the clinical knowledge to respond, but I think this is a serious allegation, if you will, and so we should follow up with that. I don't want to let that go. I think I don't know what the best steps are, but the idea that SDF can cause an abscess, we are not seeing that, but we should research that further. Also, the fluoride varnish being as effective as SDF, we are not seeing that. We are seeing that SDF has, even if applied only once, has the opportunity or the promise to arrest dental decay at like 80%. Ideally, it's applied more than once, but that is why we're so excited about SDF and the use of SDF as part of 802 Smiles, because it feels like for the first time, we actually have the opportunity to alleviate pain and arrest dental decay in public health settings, and therefore just bringing these benefits to a lot more people.
Yeah, the ADA non-restorative guidance looked into a comparison between fluoride varnish and SDF for resting decay, and they unanimously recommend SDF as the most effective for primary and permanent teeth. So seems like the arrest rate is much higher with less frequency of application. So that works perfectly in a public health setting, which was part of our, I think part of the decision and part of our arguments for using SDF in public health settings when we had the meetings with the board way back in 2017 to discuss this matter. And both sides were heard at the time, and the deliberation was that, yes, it's beneficial in public health settings, let's use it. But you're right. I think our hygienists receive ongoing training from a dentist who has a lot of experience with using SDF for many years now. If there's any suspicion of the pulp being exposed, we would by no means recommend applying it directly to the pulp. But
Yeah, so that's my point, is that if it's a deep lesion, the safe thing is to stick varnish on something super deep, and that's still gonna benefit that tooth, and you're not gonna risk, causing symptoms. Whereas if you got something, you can stick SDF on everything else except the deepest one, stick varnish on that one, cover that with varnish first, then stick SDF everywhere else, and you're still gonna benefit the kid, but you're gonna cut down on the risk to the kid. Because, it's not,
Yeah.
it's not a zero risk.
Yeah, I think this is why these conversations are so valuable.
Yeah.
And I think if we can continue these conversations, I think it's great. I think, again, like Dr. Collins said, we're all in support of SDF also. We use it quite a bit, probably not as much as he does or you guys do, but I think that the case selection is important. But again, I think if we could talk through these more often, I think it would be great. And especially from a stakeholder like Dr. Collins, who's going to see patients or get the call after hours for a kid with a toothache. I think worth having some conversations with them along the way.
Great.
So
And I did want to point out, I put the evidence-based guidelines that Deborah referred to in the chat, just so you have that. But we can send follow-up information as well.
Great.
So I think, Dr. Collins, if you're willing, and Robin, I'll kind of connect everybody after this, and Deb and everybody who wants to be involved. Maybe a couple of whatever you want to call it, task force meetings a year or something, just to connect and talk through anecdotes like Dr. Collins has, and ways we can all work together to get around this and make it work for everybody. I think that might be valuable. If you guys are up for it and agree.
absolutely.
Yeah.
Absolutely. Yeah, that's awesome.
And Justin,
Awesome
let's
idea.
add, I think you suggested this, Justin, but I think we should add some of the other major pediatric providers to the conversations that are interested.
Yes, some of the feedback I had was from the Timberlane people, because we work with them a lot, but Friday's a very popular day for pediatric dentists to be in the OR, apparently. So, we can work together to find a time that works for everybody, or at least works for,
Yeah, I know Timberlane would be happy to be involved, because I talked to Lauren Gulka at Timberlane last Friday, because we were both in the OR together. And I was talking to her about this meeting, and she's on board representing them in future stuff. So I know that they'd be interested. And I know Steve Reyes would be interested as well.
Yep. They all actually wanted to attend, but Steve's in the OR also at Dartmouth, and I think Lauren's in the OR at UVM. So.
And I promise you can't give up OR time. It's like,
right.
It is. Yeah, hard to come by and very much needed.
I was gonna say, dentists get OR time on Fridays because nobody else wants it, but I don't know if that's the case anymore, because I think everybody wants any time they can get. So Patrick, obviously I'll include, from our VSDS perspective, it may not be me going forward, but somebody from the board should probably stay involved in this.
Yeah.
Not that I'm trying to dump it off. I'm happy to be a part of it, but September I disappear. So
No, you do not.
so again, I'll connect all of us afterwards, unless do you guys have anything final you want to say? I mean, I think conversation's great. I think these are all, I think the backbone is that we're all in it for the same fight. We all want to get kids the best care and get every kid dental treatment. And I think that's as long as we stay in that lane, we're all doing this for the right reasons.
Yeah,
Agreed.
and we want to reduce the number of kids going to the OR as well.
Yeah,
That's
yeah,
just
no
a final
So we all have
comment.
Fridays off.
Bend that curve.
Or the ED, which is more our scenario. But yes, I agree with you. Thank you all for taking an hour here Friday. I know we went a little long, but let's I'll send it an after kind of summary of what we did. I'll include some of the other folks from the PEDS practices, and we'll hopefully be able to kind of meet on a more regular basis. And
Maybe we could agree every 3 months just for starters. Does that make sense?
That would be fine. Yeah.
And we can communicate by email in between.
In between,
Yes,
absolutely.
if anything comes
Absolutely.
up that needs.
I would encourage, and I'll maybe I won't blast you all with emails, but maybe Robin and Brian, if you want to connect after this to talk about, and Deb to talk about the specific examples that you're talking
Yeah.
about, to see if there's something more targeted that can look into those.
Yeah, sounds good.
All right.
We'll be in
Great.
touch. Bye, everybody. Good to
Thanks,
see you.
everyone.
Thanks.
Have a great
Bye.
day.
You too.